You've probably seen the question, what happens if you suddenly stop taking Zoloft? For many people, nothing, at first. But within a few days, strange things may begin to happen. Brain zaps, dizziness, panic attacks, insomnia, emotional numbness, or even feeling worse than before the medication was started. Zoloft, also known as sertraline, is one of the most prescribed antidepressants in the world. But stopping it suddenly, without tapering, can lead to serious consequences. Here's what the science says, and why tapering is not optional. Zoloft, sertraline, belongs to a group of medications called SSRIs, selective serotonin reuptake inhibitors. It's commonly prescribed for depression, anxiety, panic disorder, PTSD, OCD, and more. It works by increasing levels of serotonin in the brain, a neurotransmitter that plays a key role in mood, sleep, and emotional regulation. Over time, the brain adjusts to the presence of the medication. That's a good thing when the medication is needed, but it also means removing it too quickly can disrupt that balance. This isn't about addiction. Sertraline is not physically addictive, but the body and brain can become chemically dependent on the steady serotonin regulation it provides. Stopping Zoloft suddenly is known as abrupt discontinuation. This can cause what's called SSRI discontinuation syndrome, a cluster of withdrawal-like symptoms caused by sudden drops in serotonin activity. Symptoms may include electric shock sensations, often called brain zaps, nausea, headaches, dizziness, or balance issues, heightened anxiety, trouble sleeping, crying spells, mood swings. These effects usually begin within 1 to 3 days after stopping and can last for several days to a few weeks, sometimes longer. They're not dangerous in most cases, but they can be deeply distressing and impair daily functioning. Sertraline has a relatively short half-life, about 26 hours. That means it leaves the body quickly once stopped. As the drug clears, serotonin reuptake resumes and levels can drop rapidly. The brain doesn't have time to adjust, which leads to a kind of neurochemical shock. In contrast, longer-acting SSRIs like fluoxetine, Prozac, are less likely to cause these effects because they taper naturally as they leave the body. The more sudden the drop, the more severe the symptoms are likely to be. And this is especially true for people who have been on the medication for more than a few months. Some people believe that feeling worse after stopping means the depression is back. But that's not always true. Discontinuation symptoms are not the same as relapse, although they may feel similar. They can include anxiety, sadness, and irritability, but they're usually short-term and different in character. Unfortunately, this confusion can cause people to either stay on the drug unnecessarily or restart it out of fear, without proper evaluation. Others stop cold turkey because they feel fine and believe they no longer need it. But the absence of symptoms does not mean the brain is ready for the sudden removal. Discontinuing Zoloft should always be done under the supervision of a healthcare provider. Tapering means reducing the dose gradually over a period of weeks, sometimes even months. The exact schedule depends on the current dose, duration of use, individual sensitivity. Other medications involved tapering allows the brain to rebalance serotonin levels slowly, minimizing or avoiding withdrawal effects. For example, someone taking 100 mg daily might reduce by 25 mg every 2 to 4 weeks, based on how they respond. Some providers may alternate doses on different days near the end of the taper to ease the transition. There is no one-size-fits-all approach, and that's why medical guidance is essential. Zoloft is a powerful and effective medication for many, but that power also means it needs to be treated with respect, especially when stopping. Stopping suddenly is not just uncomfortable, it can be dangerous to mental stability. If discontinuing is the goal, it should be a planned, supported process, not a snap decision. Always consult a doctor or pharmacist before changing any medication. And remember, withdrawal isn't weakness, it's biology. Understanding how these medications work is the first step toward using them safely. Subscribe to learn what's beyond the labels.